wabarakatuh. Good morning, everyone. Thank you for joining us today. Welcome to this guest lecture, a collaboration between the Department of Health Administration and Policy and the PUIPT Center of Excellences for Patient Safety and Quality. My name is Intan, and I'm honored to serve as your moderator for today's session. Today, we are privileged to gain insight from our distinguished speaker, Dr. Shyamkumar Sriram from the University of North Texas, who will be sharing valuable knowledge on hospital accreditation and patient safety in the U.S. And we truly appreciated his presence and willingness to share his expertise with us. Okay, ladies and gentlemen, allow me to introduce our esteemed speaker for today, Dr. Shyamkumar Sriram. He currently serves as Assistant Professor of Public Health and Health Services Administration in the Department of Rehabilitation and Health Services at University of North Texas. Dr. Sriram holds multiple advanced degrees, including sorry, wait. Apa saya terdengar? Okay. Uh, Let me continue. Dr. Sriram holds multiple advanced degrees, including Doctor of Medicine in Community Medicine or Preventive Medicine from Dr. NCR University of Health Science, India, Doctor of Philosophy in Health Services Policy and Management from the University of South Carolina, USA, Master of Health Science in Global Health Economics from Johns Hopkins Bloomberg School of Public Health, USA, Master of Science in Global Health Policy from the London School of Hygiene and Tropical Medicine, UK, Master of Public Health in Program Design and Implementation from Tulane University, USA, and Master of Business Administration in Hospital Administration from Tamil Nadu Open University, India. And he also has extensive experience in public health research, policy evaluation, and global health system. He has worked with the Center for Disease Control and Prevention, or CDC, as a prevention effectiveness fellow and has contributed to numerous studies on healthcare policy, accreditation, and patient safety. Okay, without further ado, let us welcome Dr. Shyamkumar Sriram to deliver his presentation. But we already have uh, new news from uh, this person today. So we apologize as the speaker is currently in an emergency situation at the emergency room right now. So therefore, we will be presenting a recorded version of their lecture. And as a result, the Q&A session will be canceled for today. Okay, maybe host can play the slide, the recorded version.
Hi, I'm Dr. Shyamkumar Sriram, and I'm happy to meet all of you virtually today. So today's topic is hospital accreditation and patient safety in the United States. Let's start by understanding what is meant by accreditation and how hospitals are accredited in the US. So what is meant by accreditation? Accreditation is like a stamp of approval that is provided to hospitals, schools, or any other businesses that they maintain certain quality standards. So an authoritative body that performs this accreditation is called as an accrediting body. So hospital accreditation is defined as both a self-assessment and also an external peer assessment that are used by healthcare organizations to make sure that the level of performance that they are having, the level of care delivery, patient outcomes they are having, meet the established guidelines or standards in the field. So, to put in a simple words, hospital accreditation is mainly about improving how care is delivered to the patients and whether the quality of care main, like reaches the benchmark or the industry standards. So what are the main purposes of accreditation of hospitals? So accreditation of hospitals ensures that patients can get a minimum quality of care that is ensured for them. And hospital accreditation is very important for medical tourism because they need to attract patients globally from many different countries across the world, including US, UK, etc. So people from these countries are looking for cheaper options in the developing part of the world for medical tourism. So having an accredited hospital will attract these patients. And finally, hospital accreditation helps in improving the effectiveness, efficiency, cost containment, and reducing medical errors and improving patient safety in the hospitals. Another important purpose for hospital accreditation in the US is because hospitals need to maintain certain environmental standards. So accreditation is very important to make sure that hospital adhere to these standards. And another important purpose of accreditation is that in the US, there is an organization called Medicare that provides healthcare, or in short, provides healthcare payment to the hospitals that provide care for the elderly. So people who are more than 65 years of age. So hospital needs to be accredited so that they can get payment from Medicare for treating the elderly people who are more than 65 years of age. If they are not accredited, then Medicare will not be paying to them. So the hospitals will not be getting money for the people who are more than 65 years they treat in their hospitals. And also hospitals need to be getting accredited to get payment from Medicaid. So Medicaid is an organization that provides, payment to the hospitals for providing care to the people who are in the below poverty line or the low income individuals. So hospital needs to be accredited to get paid for providing care to the people who are below poverty line or 130% of the federal poverty line. So around 4,400 hospitals in the US are currently accredited, and around 1,000 hospitals went for state accreditation in the US. So hospital accreditation has been developing in the US for the past century. So in 1917, the American College of Surgeons first established the first standards for hospital accreditation. Then over time, there has been improvements with more organizations accrediting very special features of the healthcare system. For example, special accreditation for rehabilitation services, special accreditation only focused on safety and quality. So other important milestone was in 1951 when the Joint Commission was established. And in 1964 is the time when the Centers for Medicaid and Medicare Services were established, because Medicare and Medicare Services are the biggest payer of healthcare services in the US. So this was the time that was established. And in 1966, the Commission on Accreditation of Rehabilitation Facilities was founded, because this is for hospitals that are specifically providing rehabilitation care. And in 2007, the Joint Commission was named as TJC. And in latest in 2025, so there's a lot of integration of AI driven patient safety monitoring and predictive analysis in the accreditation process. This is how over the past century there has been gradual improvement both in the number of standards that have been included in hospital accreditation and also the number of specialty driven hospital accreditation for different specific services that are provided by the hospitals. Benefits of accrediting a hospital. The first benefit is that accreditation improves the public trust by demonstrating that hospitals prioritize patient safety and healthcare quality. So it makes sure that the rights of the patients are admired and protected, and it makes sure that the patient satisfaction is regularly evaluated through consumer satisfaction surveys, etc. So accreditation The next important benefit of hospital accreditation is that it fosters continuous improvement, thereby helping hospitals benchmark themselves against the best institutions. So it provides an opportunity for the healthcare unit or the hospital to benchmark itself with the best in the field. So this helps and enables hospitals to demonstrate a commitment to quality healthcare. Hospitals also gain credibility in legal and insurance circles, thus simplifying collaborations with insurers and regulatory bodies. So accreditation provides an objective system of empowerment by insurance vendors and other third parties. Accreditation enhances the working environment for healthcare staff, improving efficiency, job satisfaction, and the performance of the staff. So accreditation is very important for improving the infrastructure, maintaining cleanliness, providing faster services, and good maintenance of the health equipment in the hospitals. Finally, the accreditation helps in strengthening a hospital's reputation, making it a preferred choice for patients and stakeholders. So it increases the credibility of the hospital and it shows its responsiveness to improvements and makes full transparency of what is going on in communication with the staff and the stakeholders and the patients and shows its hunger for improvement to provide better quality patient care. So what are the main driving factors for accreditation? Insurance companies often require accreditation for reimbursement approval. State and federal regulations mandate accreditation to uphold safety and care quality. Accredited hospitals minimize medical errors and ensure a patient-centered approach. Patients actively seek accredited hospitals, making accreditation a competitive advantage in the field. And finally, medical tourism is growing and international patients prefer accredited hospitals for their trusted healthcare services. So this slide shows the accreditation process. The accreditation process includes several steps. Application, followed by self-assessment and external evaluation. If they meet the required standards, they receive accreditation, which must be maintained through regular compliance checks. So this is the complete cycle of the accreditation process. Understanding hospital accreditation requires recognizing its significance in healthcare quality and safety. Accreditation is not just certification. It's a commitment to excellence in patient care, operational efficiency, and regulatory compliance. It ensures that hospitals meet international and national standards, fostering trust among patients, providers, and policymakers. By adhering to the accreditation guidelines, hospitals enhance credibility and contribute to a safer and more effective healthcare system. So some of the major accrediting process have been developed by the Joint Commission, Healthcare Facilities Accreditation Program, and the DNV. So Joint Commission has been accrediting hospitals for more than 70 years in the field. Some of the major challenges of hospital accreditation include high cost of accreditation and the extensive documents that are required for accreditation, training of staff and compliance burdens, and also the important problem of balancing standardization principles with providing personalized patient care. There are several key organizations responsible for hospital accreditation in the US. These organizations establish, enforce standards to ensure healthcare facilities provide high quality care. Some of the most notable accrediting bodies include the Joint Commission, the TJC, the largest and most recognized accreditor focusing on patient safety, quality standards, and continuous improvement. The next organization is the National Committee for Quality Assurance, NCQA. This specializes in accrediting health plans, managed care organizations, and patient-centered medical homes. And the next organization is Commission on Accreditation of Rehabilitation Facilities, SCARF, focuses on rehabilitation facilities, ensuring quality services for individuals with disabilities, substance abuse disorders, and mental health conditions. And there is a Utilization Review Accreditation Commission, URAC. This accredits healthcare organizations with a specific focus on telehealth, health plans, and quality improvement in healthcare delivery. And finally, there is a HFAP, that is the Health Facilities Accreditation Program, a recognized accreditor for hospitals and medical centers focusing on Medicare compliance and patient safety. These organizations play a vital role in shaping healthcare quality and ensuring that hospitals meet the highest standards of care. Some accrediting bodies conduct unannounced surveys to ensure continuous adherence to standards. This prevents hospitals from preparing only for scheduled inspections. So we are going to see about the Commission on Accreditation of Rehabilitation Services, SCARF. Founded in 1966, the Commission on Accreditation of Rehabilitation Facilities is an independent non-profit organization dedicated to accrediting health and human services. CARF ensures that healthcare providers meet rigorous standards in quality, safety, and effectiveness. CARF accreditation isn't just a stamp of approval. It is a visible symbol of a provider's ongoing commitment to improving services and programs with a strong focus on the satisfaction of those they serve. It assures the public that accreditation organizations are continuously enhancing the care they provide. The process to receive CARF accreditation is thorough. For example, for a new survey, organizations typically need 9 to 12 months of preparation, while re-accreditation requires 6 to 9 months. This process ensures that the organizations maintain high standards and stay focused on delivering exceptional care. Since 1977, the Council on Accreditation has been leading the way in ensuring quality and accountability in child and family services as well as behavioral health care. As an independent, not-for-profit organization, COA accredits health and human service providers worldwide. With over 1,800 organizations already accredited, COA's seal of approval is a trusted symbol of excellence. What makes COA accreditation so valuable? It's recognized across all 50 states in the US by numerous national and international human service organizations. And achieving this accreditation is no small feat. It takes 9 to 16 months of careful preparation, reflecting the organization's dedication to providing top-tier services. URAC accreditation. Founded in 1980s, URAC is an independent non-profit organization that has become a leader in advancing healthcare quality. Through its accreditation, education and measurement programs, URAC helps healthcare organizations to improve their services. URAC accredits a wide range of healthcare organizations, with some certifications covering the entire organization and others focusing on specific functional areas. What's even more valuable is that certain states recognize URAC accreditation, allowing organizations to use it to meet regulatory requirements, saving time and effort in separate state reporting. The accreditation process is efficient, with a preparation period of just 4 to 6 months after the application is received, making it a streamlined path to demonstrating quality and compliance. Founded in 1990, the National Committee for Quality Assurance is a private not-for-profit organization dedicated to improving healthcare quality. NCQA accredits a variety of healthcare organizations from health plans like HMOs, that is health maintenance organizations, and PPOs, that is preferred provider organizations, to physician networks, medical groups, and even individual physicians. NCQA seal is recognized nationwide as a symbol of quality care and patient safety. It is more than just a certification. It signifies an organization's commitment to meeting high standards in healthcare. And the preparation period for accreditation can vary depending on how ready the organization is with its policies, procedures, and processes. The more prepared they are, the smoother the path to earning that prestigious NCQA seal. Founded in 1951, the Joint Commission is an independent non-for-profit organization that accreditates healthcare organizations worldwide. In fact, about 70% of the hospitals in the US are TJC accredited. So Joint Commission's mission is to improve safety and quality of care by providing education, publications, consultation, evaluation, and accreditation of services. The accreditation process typically takes 4 to 6 months, ensuring that organizations meet the highest standards of care. The Joint Commission standards serve as a foundation for an objective evaluation process, thus helping healthcare organizations measure, assess, and improve their performance. These standards focus on critical care procedures and organizational functions that are essential to delivering safe and high quality care. Developed with input from professionals, consumers, and government agencies, they are designed to enhance patient safety and health outcomes. New standards not only align with the current laws and regulations, but are also focused on making tangible positive impact on care quality. Joint Commission standards cover two main areas: patient-centered and management-centered standards. Patient-centered standards focus on improving care, such as access to care, patient rights, assessment, and care quality. These include key areas like anesthesia and surgical care and care of patients. On the management side, standards like quality improvement, infection control, and governance ensure organizations run smoothly and safely. Other critical areas include facility safety, medication management, and patient education, all aimed at fostering continuous improvement in healthcare quality. Every 3 years, the Joint Commission sends a team of healthcare professionals to conduct an in-depth on-site survey of hospitals. These include interviews with hospital leaders, doctors, and nurses. Since 2004, they have used the tracer method, which tracks a patient's journey through the hospital from admission to treatment across the different departments. After the survey, the Joint Commission issues a report highlighting areas for improvement, making an accreditation decision. Importantly, accreditation isn't automatic. Hospitals must reapply and undergo evaluation to maintain their accreditation status. The on-site survey process is data-driven and focuses on patient safety, quality, and real care processes. It is tailored to each organization, ensuring consistency while supporting ongoing efforts to improve quality. The survey objectives are clear: evaluate the organizations against established standards and performance elements, often aligned with CMS conditions, that is the Centers for Medicare and Medicare Services conditions of participation for deemed organizations. Additionally, the survey provides valuable education and good practice guidance, inspiring staff to continuously elevate the organization's performance. Unannounced surveys can occur between 30 to 36 months after a previous full survey, with the laboratories receiving one every 24 months. Most organizations won't know the survey date until it begins, unless it's impractical to conduct it unannounced, like with the Department of Defense facilities. Some large organizations may receive a 7-day notice due to factors like security clearance or survey complexity. The survey includes various sessions such as leadership discussions, performance improvement tracers, credentialing reviews, and an exit conference with a summary of findings. What happens after the survey? If an organization has no requirements for improvements, RFIs, the accreditation decision is official as soon as a summary report is available, taking effect the day after the survey. If RFIs were issued, the accreditation decision is made once the organization submits an acceptable evidence of standards compliance report, that is a ESC report. So now let's start with patient safety. So what is meant by safety? Let's start with this acronym. S stands for sense the error, A stands for act to prevent it, F for follow safety guidelines, E for inquire into accidents or deaths, T is take appropriate action or appropriate remedial measures, and Y is it's for your responsibility. Patient safety means preventing harm to patients during healthcare processes. It's about coordinated efforts to eliminate risks and ensure safe practices. Thanks to improved safety measures, 200,000 more patients survived hospitalizations in 2023 and 2024 compared to 4 years ago. This is data according to the American Hospital. The Joint Commission International developed international patient safety goals in 2006 based on JACO's national patient safety goals. Ensuring patient safety is at the heart of delivering quality care. Since 2006, JCI has been tracking international hospitals to ensure they meet patient safety goals. The 2017 to 2023 goals focus on key areas: correctly identifying patients, improving communication, ensuring safe use of high alert medications, guaranteeing safe surgeries, reducing healthcare associated infections, and minimizing the risk of patient harm from falls. These goals are vital to enhancing safety and quality across healthcare settings worldwide. Hospitals are people-intensive environments operating 24 by 7 to care for the sick. With open access to treatment and advice, the hospital atmosphere is filled with emotions, life, death, joy, and sorrow. Due to the constant pressure and high stakes nature, hospitals often experience stress leading to conflicts, irritations, and aggression. This makes ensuring safety a critical focus for both patients and the staff. So this slide shows how dangerous is healthcare. So you have other risky hobbies and things what you do, such as mountain climbing, bungee jumping, etc. You see that healthcare falls under this left column of being one of the most dangerous. So you have higher probability of dying when you access healthcare when compared to mountain climbing or bungee jumping. Errors in healthcare can stem from several factors. Human factors like fatigue, miscommunication, or lack of knowledge, system failures due to inadequate process or poor design, technical issues like malfunctioning equipment, complex patient conditions that increase error risk, elderly patients with age-related complications, and transitions during the shift changes where critical information may be lost. Each of these elements can contribute to mistakes, making patient safety a complex but vital focus. Why errors happen? Errors in healthcare often occur due to communication failures, where misunderstandings happen between providers or with the patients. Inadequate staffing leads to overworked teams and mistakes. while insufficient training can cause procedural errors. Poorly designed healthcare systems also contribute, and fatigue from long hours can impair judgment and performance. Addressing these factors is crucial to improving patient safety and care quality. The World Health Organization (WHO) leads the charge in improving patient safety worldwide with a vision that every patient receives safe healthcare every time and everywhere. Key initiatives include the WHO's Safe Surgery Saves Lives checklist, which ensures critical safety verifications during surgery. The Joint Commission's Speak Up initiative helps prevent wrong site and wrong patient surgical errors, while the AHRQ's Team Steps program empowers healthcare teams to speak up and stop unsafe practices when necessary. The World Alliance for Patient Safety focuses on key actions to improve global healthcare, including conducting research and finding solutions for patient safety. These initiatives like the High FICE project and Safe Surgery Saves Lives highlight critical safety areas. They also emphasize clean care, reporting and learning, and special projects in education, radiotherapy, and rewarding excellence. With tools like the International Classification for Patient Safety and Knowledge Management, they aim to create safe healthcare worldwide. The five key principles of patient safety are simple yet critical: right drugs, right patient, right dose, right route, and right time. Following these principles ensures that patients receive the correct treatment, reducing the risk of errors and improving overall healthcare quality. In 2002, the Joint Commission established its National Patient Safety Goals to help accredited organizations tackle critical patient safety issues. The first set of goals went into effect on January 1, 2003. The Joint Commission identifies the most pressing safety concerns and creates tailored goals for different accreditation programs to address them effectively, ensuring a targeted approach to improving patient care. So some of the national patient safety goals include use medicine safely, use alarm safely, prevent infections, prevent residents from falling, preventing bed sores, identifying patient safety risks such as behavioral health care or critical access hospital, improving healthcare equity, preventing mistakes in surgery such as ambulatory care, rural health clinic, etc. With the global medical tourism market valued at over US 4 billion, competition for patients is intensifying, leading more hospitals to pursue international accreditations. To ensure world-class healthcare is accessible, accreditation bodies must collaborate with the governments. Ongoing research is needed to explore long-term impact of accreditation on healthcare outcomes and develop strategies to overcome challenges in the accreditation process. The Joint Commission continues to tailor goals to specific accreditation programs to drive continuous improvement in healthcare quality. These are some of the references I have used for the presentation. Please free to email me if you have any doubts, and I'm happy to connect with you for doubts or collaborations, etc. Thank you.
Okay, thank you for the presentation from Dr. Shyamkumar Sriram, sorry, from his presentation today about hospital accreditation. It's a vital process that ensure healthcare organization and meet established standards to improve patient safety, patient care, patient quality, and safety. So accredited hospitals provide better service, foster and also foster continuous improvement and enhance public trust. However, the process can be research intensive, requires staff training and compliant efforts and documentation, and ensuring patient safety and maintaining healthcare quality is a shared responsibility for us, and let's use the knowledge we gain today to contribute to better hospital management and improve patient care. Uh, because the speaker cannot join us today, so the Q&A session is canceled. So we still have a heartfelt thank you to Dr. Shyamkumar Sriram for sharing his valuable knowledge and insight with us and through the recorded session. His expertise has provided us with important perspectives that will surely benefit our understanding and practice in hospital, accreditation, of course, and patient safety. So let us also extend our prayer and well wishes for his health too. And then we also extend our gratitude to all participants for joining us today, and we look forward to seeing you in future events. Wassalamualaikum warahmatullahi wabarakatuh. Have a great day. Stay safe, stay healthy. Goodbye. See you next time. Thank you. Oh, don't forget to